everyone, welcome back to my channel. This video is going to be a recap of my thyroid removal surgery, and this was all due to having thyroid cancer. We'll also have links below to different videos related to thyroid cancer and my experience with it. So just to get on into this video, when you actually show up for your surgery, my hospital required you bring an ID with you. And from what I've heard, most hospitals pretty much operate in the same way when you are having outpatient surgery. And my surgeon said that this surgery would take about 2 hours in and of itself. I would arrive 2 hours early and I would stay about 2 hours after. I got there earlier than 2 hours before, and they did get me in the surgery room a little bit earlier, and I ended up staying a little longer than 2 hours. I discussed it in another video, I did pack an overnight bag because I had seen so many stories and examples of people having their thyroid removed, and it required them to stay longer in the hospital because of their calcium levels. So I wanted to be extra prepared for that. When you show up for the day of your surgery, they put an armband on you, and everywhere you go, they're going to scan it and ask for your name and date of birth. And when they take you back to the pre-op area, it is a very large room with multiple beds and curtains around those beds. It is very impersonal. I did not like it at all. It was not private at all. You can see other people in that area. You can hear them. They can hear you. That was probably what I disliked most about the entire experience in the hospital, was the pre-op and post-op area and how they were arranged. I had my surgery at Emory Midtown, which is a very large hospital. They've been doing this a long time, so there has to be a rhyme or reason to having it this way, but it's a very uncomfortable feeling. When you first get there, they have you get into a surgical gown, and they tell you that you can't wear anything, and it was uncomfortable not wearing underwear, just so that you're prepared ahead of time. And they say that if something happens and they need to access your entire body, that they would have to cut your clothes off of you. Also, I'm sure for sterile reasons, in an operating room situation, they don't want outside things, even clothing and garments. It was very uncomfortable, and I did not enjoy it. I almost wish I had just kept it on and told them, can you just cut it off if you need to, because I don't care. It's also really awkward when you're sitting there naked in the hospital bed. You have sheets and stuff, and the nurse assistant that I had even had made like a makeshift bra for me out of a bed sheet. But especially if you're a woman having this surgery, you've got a lot going on in your chest area. It's going to be really uncomfortable not wearing a bra. I wish I had asked if I could just like lower my straps, and if they had to cut it off, do that, or like lower my bra itself. It just was really, really uncomfortable. I didn't like it. Also, before your surgery, they'll start you on an IV, and they'll have the anesthesiologist and your doctor come and talk to you about your anesthesia and your surgery and what they plan on doing. Just a little recap. After all of that, you can have your friends or family or whoever's with you come back. My husband came with me, so I was able to talk with him a little bit. And then you wait until your surgeon is ready for you. As I discussed in the pre-op video, I definitely suffer from nausea with anesthesia, so they gave me a patch and also medication after my anesthesia that helped with the nausea. I didn't experience any nausea that day, or I did the next day at home or 2 days later at home, but it was very minimal. I actually put that patch back on in the back of my ear and it went away. So if you do suffer from nausea with that, definitely get the patch. So when it was they take you back and the anesthesiologist talks to you until they actually have you under. They told me that I would probably have a sore throat after. Obviously, I have a incision in my neck now from where they removed my thyroid, but they also inserted a tube for breathing. So I underestimated how sore my throat would be and how much pain I would be in after. And also when I woke up, I was in a lot of pain. I'm not sure if I was given a pain medication immediately after, but I woke up and my neck felt super heavy, my throat really hurt, and as soon as the nurse saw that I was awake, she starts talking to me. She was sitting outside of my curtain area where my bed was, and I kept telling her, it hurts, and I'm sure to her it sounded like, it hurts, something like that. And she made me repeat myself many times. I did not appreciate that. It really hurt to talk, and I wish she could have just come closer to me. Also, in pre-op, there was a place where you could hit a button for a nurse. It didn't have that in post-op, or if I did, I didn't know where it was, and it hurt too much to ask. So I would ask about that ahead of time too. She did give me a dose of fentanyl, I think it was, for the pain, and I'm not sure the exact dosage of it. And a little while later it started to hurt again, so she gave me another dose of it. And after, it was probably an hour, she asked if I could eat something. I said I don't want to swallow. My throat really hurts just swallowing with nothing in it. So she brought an applesauce. I was able to get that down so she could give me an actual pain pill. It did take the edge off, but it definitely did not make me pain-free. I think I have I don't know the exact way that you would say it. I need more pain medication probably than an average person to feel relief, is what I think. And my husband had to pick up our baby and come back to pick me up from the hospital. I would recommend, whatever, following with your hospital's policy, that you have somebody with you post-op when you wake up so they can help you, because the nurse was nice, but she really didn't help me very much, and I had to talk a lot to her, and it really hurt. Maybe even having a pen and paper so you can write down what you want instead of saying it, because your neck is going to be in so much pain. They checked my calcium levels and all of my blood work after surgery, and I was able to go home. I would not suggest bringing a baby or small children after you've just had surgery. You're in a lot of pain. You're still kind of woozy waking up from the anesthesia, and my baby was impatient. He was in his car seat. He didn't want to sit in his car seat. He wanted to see me. He wanted me to hold him. He was whining a lot. It's not his fault. He's a baby. But it might be easier if you have small children to just have them stay at home. Make sure you get home and get your pain under control before you spend a little time with them, is what I would suggest. So when we left the hospital, I had been given a prescription for a pain medication and also for the Thyroid that I would start taking the next day. We went to the closest pharmacy to the hospital that we use, Walgreens. We went to the closest location to the hospital, and I was told that it would be an hour-and-a-half wait, and I asked if there was any way to kind of expedite that. I had just had surgery. They could see that I had a fresh cut to my neck, and the pharmacist was very matter of fact and not very empathetic, and she just said it's going to be an hour-and-a-half, not anything else. So I asked if I could submit my prescription there and pick it up from my local Walgreens, since it was going to be at least an hour drive home, and she said that you could not do that with a pain medication. And again, she was not very accommodating. I know that she was limited by law with that kind of prescription, but she just did not seem to care at all. So I said, fine, I'll go to my local pharmacy and take my chances waiting there. So we called my pharmacist on the way home, and he was very nice, and he said, I'll bring it in, I'll fill it right away. He's like, you just had surgery, you have your baby with you, you got a lot going on. So we made it about an hour later to my regular pharmacist, and my pain medication was, what I had felt of it was definitely wearing off, because I really didn't feel like my pain was managed when I left the hospital, if that makes sense. I also was not vocal enough about that to the nurse. I just wanted to get out of there and go home. So we did get to the pharmacy. The pharmacist filled it right away. He explained everything to me and explained the Synthroid and when to take it, and told me to call back if I needed anything. He was super, super nice and super great and got it done for us right away. We were so appreciative. And I actually did write an email to Walgreens about him and thanking him for that situation because it was very difficult and very painful, and he was very empathetic and helped us out a lot. I definitely underestimated coming home, and first of all, the amount of pain that I felt, and secondly, how difficult it was to talk. Talking really hurt, and also it was very difficult to swallow anything. I remember taking sips of water, and I took too large of a sip, and I don't know if I was so swollen I couldn't swallow it all or it hurt too bad, but I ended up coughing instead, which hurt even more. So I tried to do small like to relieve that, and you're really not able to cough very well. So just be prepared for that. I did not think that that would be the case, or for some reason I didn't really think about that. Also, it would be helpful to have somebody helping you. Not like help you walk around, but somebody who can bring you food or have stuff already there in advance that is soft enough for you to be able to have after a surgery like that. My super good sweet friend brought me chicken broth and soup, and also Boost little nutritional shakes, but any kind of protein shake that you can easily swallow would probably work better too. But I'm warning you, take small sips because you're going to be so thirsty and hungry, because I didn't eat all day. I had the applesauce and pain medication, that was it. So I was thirsty and hungry, especially not being nauseous with my anti-nausea patch. The hunger definitely, hit me. But take very small sips of things. My friend helped me, which was great because my husband had our baby that he was taking care of, so he didn't have to try to take care of both of us at the same time. If you have a really good friend or a family member who can come and help you that first day, help you make food, just do anything that you may need, that I think would be a good idea. I would also suggest, maybe not that first night, but definitely going into the second day when swallowing gets easier, I would suggest taking some kind of fiber supplement. I did take a stool softener and I did take Metamucil, and I had to take that for several days before it helped me go number 2. I had both of those things on hand from when I was pregnant and also after I had my baby, because I also needed that. Anesthesia and pain medication can make it very hard for your bowels to function properly. So this might be too much information, but keeping it real, make sure you're taking something. I think the nurse even suggested to my husband that I use a stool softener. You're gonna need it. That's just how it works. That's life. I would also recommend taking your pain medication before you have to do something that's going to require a lot of movement, if you can't just rest and relax. Like showering, especially if you're going to wash your hair. If you have a lot of hair, you don't really realize how heavy it gets and weighed down until you have to go like this and you have a cut in your neck that really hurts. So I would recommend taking your medication like half an hour before you shower. When you feel it kicking in, then go and take care of your hair so you experience less pain. I actually wasn't planning on washing my hair. I was sitting there and my friend who came to help me looked at my hair. I had it done recently, and she was like, "Did they get a patch of red dye in your hair?" I was like, "What are you talking about? That's crazy. They would have seen it." Well, I had noticed in the post-op, I thought that the gel that they used to close my incision, I thought that they had gotten some of that in my hair, so I brushed it out in the post-op area, and it was actually dried blood. Somehow it got into my hair and it had stained it. It came out in the shower, but be careful and just take a shower and wash your hair when you come home from the hospital, because all kinds of things are crawling around from there, and you can be clean again if you just are able to shower. So just a recap, that the first day is really going to hurt with pain. I definitely underestimated that. You're not going to be able to swallow very easily, and it's going to suck, but as the days go on, it gets a lot easier. The pain becomes more manageable. My first day home, I had to call my doctor. I spoke with one of her nurses, and I told him I am experiencing a lot of pain. I've had surgery before, and I do not remember being in this much pain after. And he suggested that I take an ibuprofen after I take the actual pain medication, which I think was a Percocet 5 milligram, and also acetaminophen in there. So I asked, okay, how much ibuprofen should I take? And he said 1 pill. I think he meant 1 200 milligram pill, because I wasn't given a prescription for ibuprofen, which would have been an 800 milligram. So when I have a headache and I take ibuprofen, I take 4, which would be 800 milligrams, and that gives me a little bit of relief. So I just said okay, bye to him, and took 4 ibuprofen. That didn't really have an effect, and I sent a message in my patient portal to my doctor that I had talked to the nurse. He said to take ibuprofen, it wasn't helping. What else could I do? One of her other nurses called me back and said to take 2 of my pain pills at once, and the next time I took it to just take 1. And then she suggested taking 2 more in the morning, because that's when the pain was the worst, because that's when I was coming off of taking the pain medication. So if you are experiencing pain, I feel like, especially that nurse made it sound like my pain wasn't reasonable, or it wasn't what I should have been feeling, but you know your body, you know what you're feeling, and express that as best you can to your doctor or their nurses, and get the point across. If you're still in pain, you're going to have pain and discomfort. That's just going to happen, but it should be managed and manageable, and I don't think that mine was, and that first nurse, I don't feel like took me very seriously. So like I said, you know your body, so try to communicate that as effectively as you can. I also forgot to include that the night that I came home from my surgery, and well into several days after that, my entire neck area, under my chin, my actual neck, right around here, the back of my neck, that whole area was warm to the touch and red and very swollen. If you look at some videos of actual thyroids being removed, it's pretty intense what they're doing, digging around there and separating that opening so they can get inside and do what they have to do. So that probably explains that. It was very red and irritated and itched like crazy. And I did put hydrocortisone cream on, which helped a little bit, but I was itching a lot. One time at night, I even woke up and I was itching. I didn't even know I was. So just be careful with that. Make sure you don't. It wasn't my actual incision that itched. It was just everywhere else around it, on my neck and under my chin. So be prepared with hydrocortisone cream, but that really didn't even help, because I feel like it was something much deeper that was making it itch. So I kind of just had to wait for that to go away. So like I said, each day will get better after surgery. I'm going to do some more videos as the days go on, to just kind of update you guys on pain, and then also through this whole thyroid cancer journey, to see what kind of medication works and what works best. I think I'm taking the generic form of the Synthroid right now, 125 milligrams a day. It hasn't been too challenging to take that in the morning. Also, I did want to warn you, so the first day after surgery, when you take that Synthroid medication, you have to wait an hour before you eat. And if you're like me, you will have a hurting tummy if you take pain medication without any food. So that first hour after you take your Synthroid is going to hurt a lot, because you won't have had that pain medication from overnight and you need to wait to eat. So just be prepared for that. I would suggest just laying down. Don't talk. Don't move your neck. Don't do anything. Try to sleep if you can. and just rest until you can get that pain medication in and you can feel it working, because it is not going to feel good. And if you hear screaming, that is just the baby. He is curling around like crazy. So I hope that this video helped. If you have any questions or comments, please leave them below. Like I said, I'll keep doing videos to document progress. If you did like this video, please give it a like and also subscribe to my channel, and I will see you in my next video. Thanks. Bye guys.